As a provider, have you wondered about how to talk to your patients about measurement-based care in the questionnaires, or how to incorporate it into your regular practice, or how to help a patient who's having problems completing the questionnaires regularly? To answer these questions, a provider will role-play some example situations. Here, the provider, Dan, introduces measurement-based care to his new patient, Jen, in a way that supports shared decision-making.
We have a system here where we have you filling out questionnaires that are helpful for us to monitor how you're feeling. So there might be a depression questionnaire, an anxiety questionnaire, there's a sleep questionnaire, so there's a number of them. In fact, I think you filled them out before the session today. And we actually have people try to fill those out pretty regularly, usually about every other week or so. This is kind of like, it's kind of like other doctors' visits where you have like blood work and they check up on things. It's a way for us to just keep up and have another way of seeing what's going on with you. Because sometimes those things don't come out as much during sessions.
I see, okay.
And so we'd ask you to start to fill those out as we start treatment here. Can you see anything that might come up that might get in the way of being able to do that?
You know, maybe doing on my own time, I get busy. I can be a little bit forgetful. You know, those kinds of things on my schedule.
Got it.
I would try, but yeah, I think.
Well, actually that's a good thing you brought that up, because we actually have a number of different ways to do them that help with some of these sort of human nature elements. And one of them is that we have email reminders that can go to you if you want them, so we could put you on the list to do that. Another thing is that you could fill them out here, and we have iPads in the lobby as well as the computers in the back. And you could do it either before or after the session. Some people do it after the session because it's just on their minds, and so it's easier to remember that way. And so maybe you could do whatever works for you, and then if we have any problems that come up, we can chat about it. I'll just bring it up at the beginning of the session and just see if there's something we can change. So, sound all right?
Yeah.
After a few sessions, Dan has noticed Jen's depression score steadily increasing. He talks with her about it to see if they need to change the treatment focus.
I actually wanted to bring something up before we started today. I was looking at your questionnaires that you filled out yesterday, and I was noticing that your depression score went up considerably since our last session. So I just wanted to get a sense from you about what's been going on for you, how you've been feeling.
I've definitely been feeling more sad, stressed.
Jen has not been completing her questionnaires, and Dan is wondering what might be getting in the way. In this session, they work together to find a solution.
Before we started, I had one thing I wanted to ask you about, which has to do with those questionnaires that I had asked you to fill out here and there. I just wanted to check in with you about that, because I noticed you haven't filled them out for about a month. And there's no worry. I just wanted to just get a sense of what's been going on. So can you tell me a little bit about what's been getting in the way of doing that?
Yeah, I've just been really busy. You know, I kind of forget. And then all of a sudden it's time for our appointment, and it hasn't gotten done.
So mostly it's about just forgetting and being busy.
Yeah, it's just hard to kind of remember to fit it into, you know, my life when I'm not here.
It's mostly about fitting it in. I wanted to get your general feelings about filling them out. You know, like how you're feeling about having to add that on to the other things you're doing.
I don't mind. I mean, I definitely see the reason for them, and it helps me to kind of see and track my, my progress.
It's just a matter of like,
get so busy that I forget.
Okay. So it seems like what you're saying is that you can see the benefit, and you understand sort of why we're having you fill them out, and that the question is how to make sure it happens more. And maybe we can chat about that for a minute. Just try to understand. So, you know, there are different ways that we typically have people sort of do this. One is to come before the session. We have iPads in the lobby. You can fill them out there. You can also wait and do it after your session. It's an option, which for some people it's best because it's on their mind, so they just do it. And for other people, they like to do it at home, and they use the email reminders to do that. So I guess I'm wondering, like, of those options, like, are there certain things that might work best for you?
Yeah, I'm afraid I forget to get here early, so I think maybe the best course of action for me would be to do it afterwards, because I'm already here, and it's sort of like part of, you know, the checkout process kind of thing.
So taking 10 minutes or so to fill them out right after the session.
I think that would work.
Why don't we try that, and we'll see how it goes, and then there's no pressure. I just want to make sure we're checking in on it, because it really does help us quite a bit. So
understand.
Okay, let's talk about what we were doing last week.
Okay.
After many sessions, Jen has been doing much better. Based on both her self-report and her questionnaire scores, it seems she may be ready to transition out of therapy. Dan talks with her about this.
So Jen, it's good to see you today.
It's good to see you too.
Glad you're here, and I wanted to start by just saying that I was reviewing the questionnaires that you'd filled out, and I noticed that a lot of them were much lower than when we started treatment, and we've been monitoring, but it seems like things have been changing gradually over time. I guess I want to make sure that that fits with your experience of treatment.
Yeah, definitely.
And what's your sense of sort of what's been making this better? Has it been because things have been different in your life, or maybe because you're feeling like you're coping better, or like?
Yeah, I feel like I'm coping better, kind of in general.
Mm-hmm.
You know.
Yeah.
I think some of the things that we've been doing have been helping.
I see. You feel like you're able to use what we've talked about pretty consistently when things get stressful for you? And
yeah, and they've been very helpful.
Okay, wow, great. Well, I'm happy to hear that.
Thank you, me too.
You know, sometimes when that's the case, we start talking about sort of what our next steps are, you know, and what we could do differently, or maybe when we start moving toward having you finish treatment here. And so I guess I wanted to get your thoughts about that, or how you're feeling about sort of moving forward.
It sounds encouraging.
If you need more help or you have suggestions, please send us an email.